My name is Neil Russell Copeland, Neil Russell Copeland, Copeland.
And your rank?
My rank is Major.
And your unit?
I'm with the 130th Medical Group at Jaeger.
Okay.
Sure. Yeah, so the mission today was to assist with the Kanawha County Health Department in helping identify individuals within this facility who potentially could be exposed or suffering from this coronavirus or COVID-19 disease. Our job today, which was the team of 3, was to, in a really clean environment, collect nasal swabs or tests to identify patients from a potential exposure. So ideally, the process that we try to maintain is to prevent contagion. So we want to keep ourselves safe from the illness as the members of the Air National Guard, but also want to prevent us spreading the disease from room to room as we move. So we manage, if you can see back here, we have a full body suit. That's because this virus its main mode of transmission is from droplet precautions, meaning if members who are contracted the illness were coughing or sneezing, they would have the virus kind of spread it in the air, which we could get on our surfaces and then contaminate ourselves, mainly if we touch and then go to our mouth or eyes. So we have a full PPE, which is gloves, full body suit, and then a mask, which is a little bit beefier than an N95 mask, which is going to be able to filter out all the viruses that are in the air. Then from room to room, we decontaminate. So I take the samples, pass that test off to an individual who then puts it into a bag, or pass it along to an individual who keeps it into a bag, so we kind of have a clean process. Dirty, kind of dirty, and then clean. So we really try to break that process that we can transfer the contaminant down the line. So I think it's incredibly important to conduct this testing in a facility such as this, mainly because our elderly population or individuals with certain health conditions, immunocompromised, individuals who are pregnant, very young children, are thought to have a higher risk of the more severe effects of the virus. So obviously, being a nursing home, everyone would be what we call a very high-risk population. So once you have one person that tests positive, there's a percentage of individuals that can carry that illness and either be in the early stages of the disease and not presenting with the full-blown symptoms, or they may be what we call an asymptomatic carrier. So once you have one test, you really need to isolate to see how many individuals you have in that facility. If it's employees, those employees can be taken out of the facility for a time to deal with illness themselves and then prevent the spread to other patients. And then once you clearly identify which patients have it, they can go into more tight isolation precautions and really allow them to be aggressively treated for their illness, get them through that, but then again prevent the spread from room to room or in the hallways. I think it's really important in a situation where we have a kind of a global pandemic. This is not a kind of a run-the-mill situation where we have a virus like the flu that we're kind of geared up for. This is on such a large scale. We really have to pull all of our resources together and allow kind of all hands on deck to make sure we're not being overwhelmed, but also helping kind of share the burden of this process until we really get through the other end. I think we've done a great job as a state as far as trying to kind of stay home and kind of social distancing. And I think if we continue to do really well, then hopefully we start to see situations like this become fewer and far between. Yeah, I think any time that you can connect your unique talents and abilities to a need of the public is really awesome. That's why many of us, of course, wear the uniform to serve. This isn't, for a lot of reasons, people join the military or join the Guard, but for the most reasons, we kind of have a servant's heart. So I think, this is exactly why I do what I do, and I think this is why the individuals in the uniform do what we do. We want to protect the country, and that can be from a lot of things, including a pandemic. Okay. Yeah, I think this is a really great example of whole of government. We have National Guard members that probably have a mixed source of funding, some support from the federal government, from the state. We have state resources, the West Virginia Air National Guard, the Army National Guard that's been allocated by the governor to really respond to these. So there's your kind of state side. In addition, we're working really closely with the county health department, the Kanawha County Health Department, and then of course the facilities here. We have a really close association with CMC in this facility. So we have a community hospital working with a community long-term elderly care facility, and then state resources. And really it's that blended approach, working hand to hand, almost seamlessly, that allows us to really have a big impact. We're talking about 123 cases tested today plus 30 employees, probably in a span of a couple hours.